Okay, well, let's get started. Thank you, everybody, for joining us today. We really appreciate it. And we know we have a lot of our friends and colleagues from California, but we also know we have folks from across the country who are tuning in. So we really appreciate your time. I'm Brian Walty, Executive Director of the Hope and Heal Fund. If you're not familiar with Hope and Heal Fund, we're a race equity fund based in California, focused on decreasing firearm injuries and trauma. And we're now on our 8th year of existence. So really excited that you guys are joining us today. And I think I'll turn it over to Kuko in just a minute, but I just definitely wanted to say that at Hope and Heal Fund, everything starts with data. Like we want to make sure that we have really as most accurate data as possible. And we want to put that in the hands of the community. Why do we want to do that? Because we feel that data in the hands of community allows communities to design their own strategies and relevant strategies. But even more to the point, it allows communities to tell the story about their own community as opposed to other people telling that story for them. What you'll see today is these maps will showcase our homicide map and followed by our newest map, which we're excited to unveil today that many of you might have already seen. And also you'll hear from our team, Kuko and Saul, but also Frank Romo from RomoGIS. And we thank Frank for his amazing work on GIS mapping and helping us, including myself, really understand what mapping is all about. And also really wanted to thank some of the foundations who have really been incredibly supportive. One is the W.K. Kellogg Foundation for their support of our newest map, and also Kaiser Permanente for their support of the firearm homicide map. We couldn't have done it without you, so we really appreciate your support. And also a real shout out to the California Department of Public Health. They've been extraordinarily helpful in helping us access the data and making sure we have the right data set. So we really appreciate all the support from the California Department of Public Health as well. Today, we'll go through a couple of the maps. You'll hear from Kuko, Saul, and Frank. But what's important to make sure is that if you have a question at any point in time during the webinar, is use the Q&A function, not the chat function, but the Q&A function at the bottom of your screen. Saul will be looking at those questions and we'll be taking your questions in a little bit. With that, I will turn it over to my colleague, Kuko Rodriguez, who is our Chief Strategist and Chief Equity Officer. And it's all yours, Kuko.
Thank you, Brian. Thank you, everybody, for being here. Really quick, just wanted to provide everybody a little bit of background on kind of why we kind of did this and why we wanted to kind of engage in this process of bringing kind of GIS mapping to kind of the forefront of and to help us kind of look at the impact of gun violence in communities. And in part, to be very honest, it really began with trying to kind of clarify some narratives that existed. I know when I started doing work here in Hope and Heal, that kind of didn't jive with really, it didn't kind of resonate in terms of the information, what was going on in what we would see in communities. And part of that was that, the biggest narrative was that the vast majority of firearm related homicides were being driven by large urban centers, particularly LA and the Bay Area. And then when we started looking, again, I'm from the Central Valley, from rural communities. I would see it look a little bit different in these communities. And even where I live now near Santa Barbara and San Luis Obispo, you see small communities and maybe the numbers are low, but you start adding that up, it doesn't make sense. So that was kind of the first kind of rationale for us to try to kind of go in and begin to look at how this map could help us kind of clarify some of those narratives. And we'll go over some of that information. I think it made it very clear that a lot of communities and rural communities, even though the numbers are low numerically, collectively they compose a majority of homicides that are occurring, firearm related homicides that are occurring across the country. But the other part of this that was important is for us to really try to create some local access, and again, mapping some of the firearm-related homicides, so that local communities and local community organizations and advocates also had access to information that was very local, and also provide them a longitudinal kind of perspective on what was going on in communities, whether they were increasing or decreasing. And then any other kind of pertinent information related to geography. For example, from an equity standpoint, in some communities that are 90% in Delano, for example, some of these rural communities that are 90% Latino, that's a super high rate of Latinos that are dying at really high rates, given the percentages. So even though in some counties, the Latino population may not be 90%. The fact that these small communities are really affected disproportionately is an important thing to consider when you're looking at a lot of the data. Moreover, even though the rates might flatten out when you look at countywide or statewide data, it's important to also look at local data and the impact that it's having and any disproportionality that occurs in these communities as well. So I think it's an important part of this conversation. And then the final piece is that also raises some questions about how we're calculating these numbers when we're looking at 100% of the population. That's really county-wide information. And sometimes in these communities that are, like Delano, for example, was one of the communities we worked in, 50,000 people in that community. And it's, or in Lompoc here in Santa Barbara, has high rates per community, but when you put those numbers into the countywide data, then these counties become very safe or look very safe, unless you live in those small communities that are impact and again have 3 or 4 times the rates that are higher than the state average. So I think a lot of this is very valuable. It's been very helpful, and also has allowed us to engage a lot of local communities. So I wanted to kind of give that preface, and then we'll really talk a little bit about some of the conclusions that we've come to, or some of the recommendations or considerations, as we're calling them, for people to look at in terms of the data, as well as to, we'll be talking to you a little bit about our most recent map that was supported through the Kellogg Foundation, that's looking at the combined impact of firearm violence in terms of homicides, but also suicides. And again, that's a county level. It isn't down to the street level. It's county level data. But I think it's important because I think it shows the complete picture, the impact of gun violence that is occurring in many communities. With that, I'll turn it over to Frank, and he can talk a little bit about kind of where the data came from and the work that he's kind of been engaged in for the last couple of years. Frank?
Hello, everyone. My name is Frank Romo. I'm CEO of RomoGIS. At RomoGIS, we focus on working with amazing partners like Hope and Heal Fund to ensure that we can equip communities with the appropriate tools and knowledge about the work that they're in this case of violence reduction, and trying to ensure that we can equip community members, organizations like Hope and Heal Fund, with the proper data so that we can do some greater advocacy work as it pertains to gun violence reduction. So right here, I'm going to share my screen. And this, if you recognize this is our gun homicide map, which is the 2014 to 2020 trajectory. This is the first map that we came out with. This application was built by our team at RomoGIS in collaboration with Hope and Heal Fund. And we sourced data from the gun violence archives. As you can see, our source down here at the bottom. I just wanted to showcase the map to let you all know kind of what we're dealing with. As you can see right here, we have the statewide outline for the state of California, as well as the county outlines in orange. And so that's just to situate us on the map. When we're looking at the statewide view, you can see in the top right-hand corner here, we have the total firearm homicides of 12.8 thousand for that time span, the 2014 to the 2022 time span. Then if we look at the widget below there, we can see that we have a chart, a bar chart, indicating the firearm deaths by year. And notice that this is an interactive map. One of the great things about this app is that we have it as an interactive map. So as you are scrolling through, you can see I can select a specific year. As I select a specific year, not only does the map update, but we also see updates on the total number in the top right-hand corner. Now that I've clicked out of that, you can see that all of our data is present again, and we can see all of the data from the map perspective as well as from the stats perspective. This is very important because we know that with firearm homicide data and as well as suicide data, these data points are very hard to come by sometimes, and that can be because of the local authorities and how the data is being reported, the coroner's office, how that's being reported. You have a lot of different places of reporting, but what doesn't happen a lot of time is the combining of that data to one location where we can filter the data by year, by county, and really get the full picture. And I think that's one of the things that RomoGIS and Hope and Heal Fund really talked about is how do we get this baseline or this full picture of what's going on, because so much of the data is piecemeal, maybe by county or by a city, and there's not enough cohesive or coherent data to really understand what's going on. One of the other things I want to show you about the map is that as we zoom in on the map, you can see that our clusters, right now I'm zoomed into Bakersfield, you can see the clusters represent the number of incidents in that area. So as I zoom in, the clusters will start to change. And as you can also see, when you get zoomed in enough, you can then click on an individual point. That individual point gives you information such as the date of the incident, the number of people killed at that incident, the year of the incident, as well as the county. So you can see that as we go through here, we can zoom into more of the street level data, and we can really start to see what is going on in these communities. And then in participation with Hope and Heal Fund and some of our partners, we've also been able to connect with community activists and members from these communities to vet some of this data, look at some of this data, and really understand if all the data is present, what might be missing. Because one of the things that's really important is the critical conversation around this data, knowing that sometimes it's underreported, knowing that sometimes it's not all the way complete in its accuracy as well. If I click up here in the top right button, I can go back to my main view. And then the last thing I'll show you is that we also have filters over here on the left-hand side. By filters, I mean widgets that allow us to search, for instance, a specific location. For instance, this is select by a county. You saw that maybe I had a drop-down menu here where I could select the county, or I could type in to the search bar the county that I wanted to see. So as I did the first time, I'm going to go ahead and type in Fresno. I click that, then I can zoom in and just see the Fresno County data sets. Notice I still have my bar chart for Fresno County. I also have the total firearm deaths enumerated for Fresno County. If I wanted to dig in deeper, I could also look at Fresno by year. So again, here with the data, what we've done is prepared it and chopped it up enough so that it could be filterable or searchable by year. It can be searchable by county, and it can be also looked at the full scale of the state of California. And again, this is a very big accomplishment for our team because it allows us to bring all this data together for the first time. And so I'm going to go ahead and stop sharing and go kick it back over to the Hope and Heal Fund team for now.
Thank you. Thank you. And Saul, if there's any questions as we're going through, just kind of stop me if people have questions on the data. Again, the other part to point out is that, I think that what we're discovering is accessing the data through traditional means, primarily law enforcement, has been very complicated, very difficult, inconsistent reporting in terms of, I think that the CalVDRS system is exceptional. It's probably one of the best systems that we have when we talk to folks that do research. But it's pointless if counties are not participating. And I think it's important for us to note that. I'll talk a little bit about some of the findings because it relates to that, and it relates to the next map. I mean, and I think in terms of, some of the recommendations or some of the considerations that we're asking and what we've kind of concluded from this map is that, as I said in the very beginning, we really wanted to clarify these narratives that existed about where the drivers were in terms of geography of homicides, gun-related homicides. And what we discovered was that, again, 2/3 of all homicides occurred outside of the 10 largest cities in the state of California. And so when you start looking at some of these rural communities, even though there may be 5 or 10 or 15 homicides that maybe don't, match up to the large numbers that we see maybe in larger cities, But collectively in these small communities across kind of from Sacramento all the way to the Inland Empire, you start beginning to see that all of that begins to add up considerably again. So I think that that's a really important finding. And for us, it's important because from a philanthropic standpoint, it should lead philanthropy to begin to invest in some of these places that have been kind of disregarded for a very long time because of the misconception, especially around gun violence, that it's occurring in LA. And again, I'm not saying that we should not be investing in these large urban centers, but I think that a lot of these smaller communities up and down the state are also in need of support. So it has some significant philanthropic implications. And then more importantly, what's really been driving our investment, because the data clearly is stating that this is occurring outside of these large urban areas as well, large cities. Why haven't we been looking at this, or what have we been looking at that's been misleading us in terms of our investments? The second map that we're going to talk a little bit about is really when we finished this map, that was one of the things that we concluded, that we really needed to look at the total impact of gun violence in terms of by type, because even though this looks very terrible in terms of the impact that gun violence is having in terms of homicides, we can most assuredly double that, and that should give us statewide the total number of firearm-related suicides as well. But we also wanted to map that by county to see the total impact. And we'll be sharing some of that with you because I think that the findings are very interesting. Some of the counties that we would not think of are actually have really high rates, homicides and high rates of suicides, like Humboldt County, for example. So that was one of the kind of the considerations, and also led our work to develop a secondary map. The other really critical piece, I think, in this is that we really need to understand, and again, we begun work on this map as well, but we've kind of put it on hold because of the absence of data. We really thank the support of CDPH in terms of their help in trying to utilize some of the data related to trying to discern of the number of homicides, how many of these are intimate partner violence related. And that's a really important, I think, question to answer in terms of gender equity, but also in terms of clarifying narratives in local communities, especially when law enforcement asserts that homicide rates are high, but doesn't give you the disaggregated information in terms of what percentage of those are actually IPV related, leading communities or elected officials to believe that perhaps these are all gang related or community violence related. And so the little data that we were able to acquire that submitted enough abstracted information in terms of CalVDRS was out of Sacramento County and Orange County. Sacramento came in at 7 or 8% in terms of IPV related homicides. Total homicides, firearm related, and 8% were IPV related, but Orange County came in at 20%. So that's a pretty wide range. And as we talk to some advocates that do work in this area, they're estimating that can range up to 30%. So it becomes a really important number for a lot of reasons, but more importantly, for philanthropy and for government, state and local government, in terms of where we're investing, what type of gun violence we're investing in, these numbers become very, very important. And as we overlay that in geography, then that also becomes important because I think that some communities are disproportionately impacted. When we looked at the preliminary data for Fresno, for example, it has one of the highest rates of CDC 911 IPV related data, like twice as much as other states. Yet they reported zero IPV related homicides in some of the CalVDRS data. Now, granted, they didn't report all of it, but statistically, that doesn't line up. The same thing with LA. LA reported 27. I think they submitted there was 500 reports in terms of firearm-related homicides. They submitted 400, something like 400 abstracted the abstracted data was 400, but yet they only submitted 27 IPV related homicides. Just the math does not add up with that statistically. And so what we feel is that in some of these cases, some of the IPV related deaths are actually being withheld for whatever reason. So I think that data is very, very important. And again, we're speculating, but we really need access to a lot of that information, because I think it should be driving where we should be investing and how we should be addressing comprehensively the issue of gun violence on both sides, on the homicide side, but also on the suicide side. So I'll pause there for a second to see if Saul, if there's any questions that have been raised thus far, and if not, we'll jump into the next map.
Good morning. I just want to acknowledge some of the questions were, if we're sharing the links, we have already shared in the chat the link to the information that Frank was sharing, and we'll also be sending, following the webinar, we'll be sending out the link once again to everyone who signed up. The other question was just IPV and what it stands, and I think we typed it out, but in case it was missed, it's intimate partner violence. So if there are acronyms, we're very alphabet soup here. So if there are acronyms that are not defined for you, please let us know. We'll gladly define what those are, or share what the meaning of the acronyms or language that might not be familiar. We use this sometimes assume that everyone knows some of the terms. So if there is something that we can expand on, please let us know. Please use the Q&A so that we can know what to answer. But I think there are no other questions, Google, at the moment.
Great, thank you. And again, this is I think one of the questions was, is this accessible to the public? Definitely. We want the public to utilize this. We want you to look at your local communities. If you're a family member that's been impacted by gun violence, but if you're a community organization. The other part of this that I should have mentioned is that, the map is helpful for us in terms of trying to expand the work and kind of push the field to really look at the data. I think that's important. But we're also engaged in a process where we're training nonprofit agencies to learn how to map their own data. Because, I think Frank and his team were tasked with mapping all of this data for the state, which is a monumental task. But we also feel that, Frank has been helpful and his team in teaching nonprofit agencies to map their local data around gun violence. It's a lot more manageable when you're doing, smaller chunks than you are trying to do the whole state. So, I think that GIS is a lot more user-friendly now than it was maybe 10 or 15 years ago. And I think that we've been very, very successful. I think there's been about 25 different nonprofit agencies that have been trained in Northern California. And again, that was through a grant through Kaiser. And I think we are still in contact with that network of folks that are utilizing GIS now technology beyond just gun violence, because now they're tracking other information. I mean, you can use it for a variety of different things. I think that hopefully everybody sees that this is a excellent visualization tool for the research and the data that we have. It allows you to kind of look at the direct impact that's having on communities.
Google, we do have one question, or for you or for Frank, and that is there any data on hate-motivated homicides? And I know Frank went over it. Maybe it's important to point out where we source data, or where data might be available or not available, and how that translates into mapping the data, but also on speaking on hate-motivated homicides.
Yeah, I can talk about that. I think that there's a couple of folks at the state level that are trying to collect some of that data. I mean, on our end, to be very honest, because we do have a partnership with RomoGIS and we kind of understand GIS technology. I mean, I'll be honest with you. I feel that with the right data sets, if you have access to the data, it's not very difficult to plug it in. And more importantly, I would add that, we're at a place with GIS technology that if you have the right, I feel like it's kind of like physics, right? If you give me a large enough fulcrum, I can move the world kind of thing. If you give me the right data sets, I can predict what's going to happen. GIS allows you to do that because it becomes super predictive, especially, I'll be honest, in the gun violence arena, if none of the factors are changing, then you can predict what's going to happen. because we've seen no changes in any of the factors. In fact, what we've seen is an increase in access to firearms. So I think that given the right data sets, I say that because to the point around hate violence, if the data is available and it's consistent, I think it can be mapped and you can look at that. And we certainly, I mean, that might be a new area for us to go into, to consider, but I think part of it has to do with the data. You know, I spoke a little bit about the intimate partner violence map. We clearly have the homicide data. That's the map that you all viewed. We're trying to now figure out by county, or at least 10 counties, to figure out how to disaggregate the number of intimate partner violence related homicides so that we can at least say, you know, the range right now is between 10 and 20 or 10 and 30. So that at least advocates at the local community, but also in terms of funders, are looking at this as an issue and saying, wow, like our assumption right now, based on the CDC calls and based on the number of homicides, is that Fresno County is probably going to lead a lot of these rates. We don't know because we don't have access to that data. But based on CDC calls, I think that and based on number of homicides, we can kind of make a pretty good guess that it's going to be one of those communities that's highly impacted. Same thing with Bakersfield as well, and a few others. But the data is very, very critical. But all of that to say is that I think having the information allows us to map any of this. But the question is who has the data? Is the data reliable? Because that's a lot of the work that I think Frank has been engaged in, making sure that we can validate this, that we can cross-reference it, that it's valid and useful. So that may be a map that we look at in the future. But I hope that if you're not currently, the other part of this is if you're not currently using GIS technology, I really hope that you start looking at and investing in some of this, because it can be helpful for communities all over the state and all over the country.
We have a couple questions. I'm going to direct these at Frank. And some of them, I'm going to summarize what they say. People are asking if we will be adding more info to the existing tools. For example, data that are for unsolved cases. And then also, how long did it take to clean the data, specifically police data that had inaccuracy? And I think that, those are more questions for you, Frank, and some of that work. I think it's important to share some, what some of that work entails on working with the data.
Absolutely. I think those are great questions. So as Kuko was mentioning, we have sourced data from a few different places. At least with the homicide map, we went to a place called the Gun Violence Archives. And I think as we're sorting through this data, touching back on that hate violence question as well, there's not as much additional pieces of the data. We've been able to identify the location, the year, the county. We had to do a lot of cleaning there. I'll talk about the cleaning in a second, but I think what we are missing is some of those other categories. And I just say that, for instance, unsolved cases, hate violence. I know that, right? For instance, unsolved cases, that's probably within the police department of that county. So that data would then have to be cross-referenced with the data that we have. In terms of the hate violence, I know that folks in the state of California are doing it, and I know some folks who are doing it across the country. But again, we run into that same problem where the data is really disparate. Nobody's really talking to each other with their data sets. And I think that's what was so innovative and so important in the work that we've done here with Hope and Heal Fund, is that we were able to, for the first time, really put all that data together and showcase it in one map. Because right now, when you're working on data sets like this, I've been working in the gun violence data set arena for many years now, and I'm very familiar with a lot of the hoops that we have to jump through in the programming that we did through the Kaiser funding, where we trained nonprofit organizations. Two of the things that we taught the organizations we worked with was how to do a Freedom of Information Act, as well as the California Public Records Act request. And both of those record request acts allow users to basically ask the municipality, the law enforcement agency, what have you, how do I get access to that data? That data is publicly available, so I should be able to have access to it. How do we get access to that? So in teaching nonprofits, community organizations who are already doing this work, some of those additional tools like a FOIA, Freedom of Information Act, or a California Public Records Act request, by teaching them how to do those two requests, we were able to support organizations to actually get data for the first time that they'd been looking for. Because you can scour the internet and scour a bunch of different places, but sometimes you just have to use other mechanisms, and those mechanisms have proven to be successful in capturing some of that data, but even in capturing that data directly from municipalities or from law enforcement, we still run into the same issues. Well, we're only going to give you this much because that's all you've asked for. Or, well, you didn't ask for that particular information, that set of data about whether the case was solved or unsolved. So we're just going to give you what we have. So every time we talk about data that is difficult to come by, when I speak about it and teach about it, I think a lot of it comes back down to power and who has access to the data. Why don't our communities have access to the data? And this is the movement and the area we're trying to move towards, is making sure that more communities who are doing the work have access to that data so they can properly organize and advocate with some more strategy. Because for me, as a former organizer, I recognize that we have so many tools: canvassing, protesting, showing up City Hall, all of these things. But one of the things that I think is still very underutilized in our advocacy work is the technical and the data side of the piece. And so I really think it's important that I would echo what Kuko has said. And if you are interested, or even interested in understanding how the data works, or interested in using GIS in your local community, don't be scared of it. It's a very powerful tool, and it's one that we should have in our tool belt when we're working to advocate for these changes in our community. As far as it pertains to cleaning the data, for the California statewide map, California is a very big state. I've done it for smaller states. California is a very big state geographically, and California is a very populous state. So there are many incidents. I would say probably, probably took a good, probably about 6 months to clean. That cleaning of the data entailed us. I also put the acquisition phase in there. So we had to acquire the data by scraping it online. After we scraped it online, we compared it by scraping. I mean, we pulled it from different places online by writing code to get it off of certain websites. Then after we did that, we had to put the data together. So that was ensuring that the county and the city names were spelled correctly. They were properly, the data was properly organized and formatted, and then actually mapping the data, which comes to, with X and Y coordinates, or latitude and a longitude. So we had to get points in the right places, because when we're doing this geographic work, our accuracy and precision is very important. So we want to make sure we don't introduce additional errors when we're trying to create a comprehensive data set. We already know there are gaps in the data. We know that the data isn't always as clean as it should be. So what RomoGIS did was really get down into the weeds to make sure that all of those things were cleaned up, so that we could map them when it was able to at the street level. When we were unable to, we've mapped it at the county level. And these are different ways that we had to work with the data depending on what data was available. So again, the maps are great, but they're only as good as your data. So I would also echo what Kuko said. This is an opportunity for us to push and ask for more data, and ask why this data isn't available, and try to gain greater access to these data resources so that we can map them and use them as strategy in our advocacy.
Thank you, Frank. We have a couple more questions, and then we'll go ahead and move on to intimate partner violence data, not intimate partner, to the suicide by firearm data dashboard, because I know some people are here to see that. So we'll go ahead and let me share the questions, and then we'll move on to that. Is the data inclusive of youth gun violence? And how do you ensure that the data is not repeated or duplicated when coming from different sources?
So again, for the great questions for the youth violence, I'm not sure exactly. Are we speaking probably folks under 18, etc.? I'm not sure, because some of the data didn't bring age information with it. Again, depending on where you source the data from, if you're sourcing it from a smaller geography like a city or a county, they might have additional columns or categories identifying that. But also if we go all the way to the next map where we're talking about suicide data, recognize that personally identifiable information is also something that is very protected by the state, by public health agencies, because that's very important. So oftentimes we didn't have additional information on the victims, but we did have basic information about the year, the location, maybe gender, but oftentimes that was also piecemeal. So we did download the data from various sources, and when we were comparing it, what we did then was to deduplicate, was to ensure that looking at those various categories, the year, the location, the agency involved, all of the information we did have, we then had to cross-reference with local news stories, with data from the local agencies, law enforcement, municipalities, whatever it might be, but that compare and contrast really helped us squeeze out what needed to actually be mapped. And we did find some duplicates, and we did document that to ensure that we got rid of those, and we verified that they were by looking at news sources. A lot of times when we're dealing with data that is a little bit shaky, going back to primary sources like news sources are tend to be a very good point of reference.
Right, thank you. And I think one thing it's important to share with those in attendance is how you can layer this data that we mapped for Hope and Heal, and how some of our partners are already using it or can use it with creation of other maps, layer other things like poverty or, or other health risks in communities.
That's a great point. So the data sets that we have are built using Esri product, ESRI, and they are a mapping organization. And so with that, they have a system online called ArcGIS Online. Our data is available through ArcGIS Online and is searchable and is able to be put on a map for yourself. So if you were able to put that on a map, then you can, as Saul was saying, you can further layer on top other data sets. For instance, when we worked with the nonprofit organizations and community organizations in Northern California, one of the final things on the final day of our workshop was that all of our participants created their own map. And so they created a map using our source data, and they put the source data on their map for Fresno County, for Oakland, for whatever location they were interested in. Then we taught them how to search for additional data layers so they can bring in other information, such as additional public health data, additional crime data, other points of reference, because as you start to layer more data on the map, you're able to get a greater picture of what's happening on the ground. The map is a representation of what's happening in real life, but using these various data sets, we're able to create a better picture of what's happening and be able to use our local knowledge and our community knowledge to understand how we might best advocate. And that's why for us, creating the homicide and the suicide map were very important, because what it does is it gives us that first baseline. Because as I said, with so much of the data being disparate and kind of not in one place, by us creating a coherent format that then can be served up to the communities that we're working with, now they can go through ArcGIS Online, pull that data into their map, and then can add their own layers as they start to explore and understand more about their community.
Thank you, Frank. And I think I'm going to direct this question at Kuko before we move on to suicide firearm data. And that is, if there are enough partnerships with county medical examiners to obtain data through death records.
That's what we're starting to do now. We were trying to go through coroner's office, but I think that I think public health has some data. We're trying to figure out. So if anybody has any access to county data or even city data, get a hold of us. We're more than happy. Like I said, this is a point at this point is if you have the data, plugging it in. We have the homicide data, so we can figure out, especially the intimate partner violence data, but any other data that I think it's relevant. Some folks talked a little bit about hate violence, or like for example, we have another project where we're looking at the incidence of police homicides. Which is it's also gun violence in many cases. Although what we're finding is a lot of the data is indicating that a vast majority of homicides that are occurring in terms of citizens, contacts of citizens with law enforcement, it's actually not. I assumed that the majority of it was gun related, firearm related, and it's not. It's actually people dying at the physical hands of law enforcement in some way. But in any case, when you can overlay a lot of different data sets to begin to look at the total impact that this is having on communities, certainly when you look at the total impact just of homicides and suicides, you begin to see and appreciate the trauma that this creates in communities. I think on multiple levels, in terms of loss of life, but also in terms of violence, in terms of whether it be a homicide or a suicide, the impacts that it has. But I think that a lot of it is really the data and who has the data, who's willing to share the data, and we can kind of plug it in. It used to be that was the hard part. That's not the hard part anymore. Now the hard part is like, why isn't this public data being released? Why aren't we transparent with this information when it has to do with public safety? And why are people refusing to participate and release this information? Because it is extremely important for us to utilize this information to guide our work and develop interventions that are very specific to the type of gun violence that we're seeing in communities. So anyways, maybe with that, we can transition to the next map, because I think that's really at the heart of what we're trying to look at with this.
So with that, Frank, if you can introduce the not intimate, sorry, I keep saying that, the firearm suicide data and dashboard.
Absolutely. Can you see my screen, so good?
Yes.
Yep.
All right, excellent. Here we go. So just really quick, before we jump into that, I want to showcase again, this was the homicide map. Remember, we had the California state boundary along with the points on the map. We were able to zoom in very closely because of the quality of the data. When we come to the suicide and homicide comparative map, you will see, again, we have the state of California here. However, within the state of California, we have the outlines of the counties, but we don't have point data. And that is, again, because when we're working with suicide data in particular, we have a personally identifiable information. When you have only a certain number of incidents, you aren't able to showcase all of the data. When we gathered it from California Department of Public Health, there was some masking in the data to ensure that there was no way that those folks could be figured out who they were in their communities. So
that was 22 counties total where the data was suppressed, just because of the numbers, the way they kind of fell. So just to be clear, so this reflects kind of 36 counties, but 22 counties were suppressed because of that, so that you were not able to identify individuals that were involved. So just to be clear for everybody.
Correct. And then if you look at the map as well, you can see some color coding. So per usual, the darker indicates a heavier instance of that rate. The lighter indicates less of an instance. So for instance, if we look at our legend here, you'll see that this map is showcasing firearm suicide rates. So if we see the darker color, you'll see that is a rate between 7.2 and 13.7 versus the lower end, which is 0 to 1, and the very, very light blue, 1 to 3.9. So as you can see, we do have some rural counties that have a very high rate. If we click on the map, this map is also interactive. You will be able to see not only the amount of deaths. So here we have the firearm suicide deaths. Again, this is from 2016 to 2022. Then we have the firearm suicide rates. As we scroll down, you can see the percent of the state total that county accounts for. And as well, we put the homicide data next to it so that we could do some comparisons. So what you're seeing here on the right-hand side is a table of that information. We have the county, we have the firearm suicides, we have the firearm suicide rates, then we have the percent of the state total that makes up. We have the firearm homicides, the actual numeric value, we have the firearm homicide rates, and the total of the state percent that makes up. You see that we have a lot of not available data here, as well as we have these asterisks. Well, any county, as Kuko was pointing out, those 22 or so that have that asterisk, that indicates that the data was suppressed because there was less than 11 incidents within that calendar year, and the California Department of Public Health did not release the full number of records that occurred because of the ability to potentially identify people. So this is some of the issues that we run into when we're working on the data, is that sometimes there's just not that data available. One of the other things that I want to point out is this map also has the ability to filter right here in the top right-hand corner. This filter is a little bit different though. We can type it in. Let's see, we can type in Fresno. We can add that. We can type in, Kuko mentioned Humboldt earlier. We could type in that. And then we can take Los Angeles and we could type in that. And we can see these side by side. So now it's not only identified them on the map, but you can see that our table is also updated. So if we look at this just across the board, the firearm suicides, so Fresno 267, Humboldt 93, 2023 in Los Angeles. Again, the point that I want to drive home here is that what is really important here is the rate, because in a place like Los Angeles with millions of people, where there are more people, there are going to be more incidents. If we were looking at car accidents, we would see the same thing. If we're looking at incidents of occurrences, you're going to find more where there are more people. So what we do is look at that per 100,000 people that live in that county. And so by normalizing the data to ensure that all of the data can be compared appropriately per 100,000 people, we can see that the firearm suicide rate in Humboldt is remarkably higher than that of Los Angeles and Fresno, with Fresno still being somewhat higher than Los Angeles. And again, although Fresno and Humboldt have less numeric values in the data itself in terms of the number of people who are killed, based upon the amount of population, you can see that the rate is kind of off the charts. And you can see the same thing as it pertains to the firearm homicides in this column: 519 for Fresno, 62 for Humboldt, 3,475 for Los Angeles. But as we look at the rates again, you can see Humboldt in this case with firearm homicides is above Los Angeles at 6.58, but Fresno is at the firearm homicide, as Kuko had mentioned before, 7.38 is the rate, with a totally a 4% total of the state, when the population is not that percentage of the state.
And that was the last column that I wanted to point people's attention to, is that we also added that column because that's an important kind of point for us to differentiate what the total percentage contribution of those rates are. Humboldt, it's almost 1% of the total state rate for suicides. It contributes. I'm not sure if it's 1% of the total population. Maybe it is, maybe it's not. But it gives you at least a point. The same thing with Fresno, the same thing with Los Angeles, gives you a percentage of what it contributes to the total state average. I think San Diego was contributing something like 8%, or 9%, something like that, in the total suicide rates. And it's not close to that. Okay, 10%. It's not 10% of the total population in California. So you can see kind of the differentiation. And again, some of the takeaways from this information that are real important, that I think folks, again, just to give folks kind of a perspective in terms of what we're looking at or what we think is important, again, there may be more, is that when you look at some rural counties like Humboldt, Tehama, Tulare, Butte, they have both high firearm homicide rates and really high suicide rates. And again, we need to dig in further. We have some speculation what that is. These are not communities that, I did a lot of work with impacted populations in terms of, incarceration. These are not the places that I think of that have high rates of gang involvement and that type of violence. So leads us to conclude that perhaps it's intimate partner violence related, in terms of high homicide rates and, again, high suicide rates in some of these communities. Again, we don't know. We're only speculating, but it does lead us down some roads so we can start looking at some additional information. And again, while all homicides and suicides, again, need to be prevented, I mean, it's pretty clear to us that 30 out of 36 counties that have reported kind of the complete firearm homicide and suicide data have really high levels of firearm suicide, firearm homicide, or both. So, I mean, this is something that we really need to look at. And if we're only looking at homicides or we're only looking at suicides, then we're missing it, or we may be missing it in some counties. Other findings, again, 14 counties have both firearm homicide and suicide rates that are above the state average. 12 counties have a higher firearm suicide rate than the state average, but lower firearm homicide rates. San Diego would be an example of that. It has a really high suicide rate and a much lower homicide rate. 5 counties have lower firearm suicide rates than the state average, but higher rates of firearm homicides. And then again, 5 counties have both lower firearm suicide rates and homicide rates than the state average. But at the end of the day, when you look at this, you're looking at 83%, about 30 counties that are high in one or the other or both, which is, I think, really, really important. And again, we talked a little bit about some of these rural counties like Humboldt, Tehama, Tulare, Butte that kind of rise to the top in terms of total numbers. that ordinarily we wouldn't be looking at. I think those stand out, and clearly there's stuff occurring in some of these communities that we really need to look at, and again, maybe develop some strategies to address, because the types of homicides and the types of suicides that are occurring, what they're related to. But without really understanding the data, it's very difficult to develop. And I guess to me, that's kind of the final. We'll leave it. We'll kind of close it here and see if there's any questions. But for us, I think that's really the final piece in all of this, is that a lot of this information should lead us to the development and trying to understand what's really going on, so that we can develop specific strategies to reduce the types of gun deaths that we're seeing in these cases. And again, in every one of these situations, if it's community violence, that's a completely different type of intervention that we have to develop that work for those populations. If it's intimate partner violence, that's a completely different kind of intervention and investment that has to be made in terms of to address that. And then in terms of suicide, again, that's a completely different type of intervention that we have to look at again. And our investments need to follow that data and look at that, especially in some of these impacted communities. So I'll stop there and hand it over back to Saul, see if there's any questions.
There is a couple of questions, and Frank, if you wouldn't mind showcasing in the map, bringing the map back and showing what the colors indicate per counties in the suicide by firearm and what the asterisks mean in the table. We're going to be sharing the link to that information after this, so shortly in the chat. Frank, the asterisks and the colors in the map, please.
Absolutely. So again, if you just recall that this map is building upon the previous one, which was our homicide map. So recognizing that we had a homicide map already in this other tab, which you have the link to, what we're showcasing here on the map itself, I'm going to go ahead and reset my filter here so that I can see the entire state. And what we're showing on the map itself is the suicide rate. At the top here, we have our average county firearm suicide rate, so we can have one that's throughout the state, so we can understand how each county stacks up to the statewide average. Notice in the legend, it tells us that the firearm suicide rates is what is being visualized. So when there is a darker county, that indicates that their firearm suicide rate, which is this column right here, is much higher than the county average. If it's got a lower level, right here, these 1 to 3.9 and the 0 to 1, these lower blues, they're either below the they're below the statewide average, or they're just about at the statewide average, again, which is 2.97. 1 or 2 counties might be above, around that 3.9 range, but anything in these darker 2 blues is above the statewide county average for firearm suicide. So what we're showing on the map is the firearm suicide. So if we go ahead and click on one of these, you can see again, Humboldt firearm suicide rate for those years, 9.87, which is why it is in dark blue, because the dark blue indicates a higher numeric value and showcases that it is above the statewide average. And as for the asterisk, so down here we have some explanation. I'm not going to read the whole explanation right now, but the explanation articulates that where there is a county that has a singular asterisk, that means 1 year of data throughout our time frame, 2016 to 22. So we took our whole time frame. Well, we had to grab that data by year from the California Department of Public Health. When we grabbed that data, sometimes that data was suppressed or was suppressed due to the personally identifiable information. When there was less than 11 suicides in particular, the California Department of Public Health reported less than 11, but didn't give an exact number. So, for instance, Alpine having 1 asterisk indicates that for one of those years, from 2016 to 2022, the data was suppressed. Versus Calaveras, which has 2 asterisks down here, that indicates that data was suppressed for more than 1 year. So that could have been suppressed for 2 years, 3 years, or 4 years. And this is, again, data would be suppressed because of personally identifiable information not wanting to be given out, meaning that if there was less than 11 suicides in that calendar year, the data was likely suppressed and not reported the exact number. So it might have been 9, it might have been 8, it might have been 7, but we won't know because it was only given to us as a less than 11 deaths had occurred in that year. So when there's a single asterisk, that means that that suppression of the data happened for 1 year throughout the 2016 to 2020 time period. If it has 2 asterisks, that means there are multiple years that data was suppressed due to personally identifiable information.
Thank you, Frank. There's a follow-up question to that, and were you able to disaggregate suicide or homicide data by gender, age, race, and ethnicity?
Again, the answer to that is no, due to the personally identifiable information. When you're working with small data sets, whether that's here or even with the census, anytime we're mapping or calculating small areas, there's often less demographic information affiliated, because the more demographic information that is available, the more likely somebody can be identified. And that is what we and in our work with public health agencies and in our best practice as mappers here, we have to ensure that people's identities are kept secure, because for family reasons, for personal reasons, for legal reasons, that's a pretty common practice. So unfortunately, no, we did not have some of that data as it pertains to suicide data. And some of that data is available for the homicide data, but it was not fully filled out, if you will. Like for all the data that we received, not all of it was available. So again, we see the sparsity in the data, we see the kind of nuances of the data and how we have to work around those things. But these are, when available, we should be able to get access to that data. But when it comes to personally identifiable information, it is often likely not going to happen.
Frank, thank you for that. One question, really brief, for people that want to find this data within ArcGIS, can you share briefly how that works and how they can use this data within their ArcGIS map in Esri?
Absolutely. So within ArcGIS Online, Hope and Heal Fund, RomoGIS helped Hope and Heal Fund set up their own account. We've helped build their infrastructure. And so building that infrastructure, we have now Hope and Heal Fund with their own ArcGIS Online account. So you can search for them as an organization. You can search for these data layers. And if it belongs to Hope and Heal Fund, you'll see a publicly available view layer that you'll be able to interact with. And so both the homicide and the suicide data are available as layers within ArcGIS Online. By that, I mean you're able to actually get the data that help build these applications. These applications themselves are also available at the public links that Saul has provided, as well as in the story maps that RomoGIS and Hope and Heal Fund worked on together. So there are multiple ways you can access them from a public-based perspective with the links. If you are in ArcGIS Online and are familiar with them, if you go to your search tab and search for layers, you should be able to find both the homicide and the suicide layer available to you.
I'll also add one little tidbit in terms of how we're utilizing some of this data. Right now, we've been engaged in a lot of work around gun violence restraining orders in the state of California. And this data is also very convincing when we're working with counties in terms of the need for mental health to begin to screen for firearm ownership or access, which counties currently do not. They do on the back end, but they're not doing it in terms of treatment planning, in terms of crisis planning, those types of things. So this has become a very important kind of advocacy tool when we start seeing the rates in some of these counties that are firearm related, and county mental health system, public mental health systems, and or health systems that are not screening for access to firearms or firearm ownership throughout their process. As well as any prohibitions that, again, that exist in the state of California. And again, this is harm to self, not harm to others. But clearly this data is pointing to that as well. And again, we are working with some counties where since COVID, they've seen significant increases in this because of the increased access to firearms for a lot of different reasons. But wanted to add that tidbit because that's an effort that we're working with in terms of trying to partner with public health to make sure, and mental health, to make sure that they're actually identifying proximity and access in terms of gun access.
We're getting close to time and just wanted to address a couple of the questions that have come in. Some of the questions have been, will we continue this effort in future years? And will we look at attempts of assaults by firearm? I do want to share with everyone joining us that this is the start. We're beginning. We have one map we're working on, which is the intimate partner violence that we're working to release next. Once that data, we can work with the data that we have, the limited data. And then we are exploring next steps, what that means as far as our ecosystem or the ecosystem in California for data in partnership with many other organizations and systems in California. But those are all to be determined. Your input, your connection, and your willingness to work with us will help us navigate what that looks like, what the community needs are, or the system needs are going forward. So
Yeah.
I just wanted to share that.
And if you have any questions beyond this, feel free to reach out. More than happy to connect. We're always looking for partners. I mean, at the end of the day, you know, I think that this initiated as one map, but the absence of technology and how to utilize technology and harness technology to solve a lot of the large social issues that we're contending with, I think that it becomes very apparent that there's a huge digital gap between nonprofit work and social activism and the use of that and access to that, how we use it. And I think this proves it. You know, I think our organizations, when we train them, realize like, wow, there's a significant amount of power, especially around narrative. For us, this isn't just technology. This is about narrative change work, creating our own narratives about what's actually going on in communities and not allowing other systems or institutions to create those narratives about us. So access to this information becomes very important. Access to technology is really important. So we're going to continue to kind of push through with this work. But again, if folks have any questions, feel free to reach out. We're more than happy to have further conversations or answer any other questions that people may have. With that, I'll hand it over to you, Saul, and maybe you can close because I think we're over 1 minute.
Yeah, we're over 1 minute. Just want to thank everyone. Frank shared his contact info in the chat. So if you want to get in contact with Frank, on behalf of Brian and the rest of the Hope and Heal team, the panelists, thank you all for your time and joining us. Reach out to us. We'll gladly connect with you and figure out next steps.